County Board of Supervisors is calling on UW Health and Children's Wisconsin to resume providing gender-affirming care to transgender and gender-diverse youth. On Thursday, the board approved a resolution urging the health system to restart access to puberty blockers and hormone therapy for patients under 18 to the fullest extent allowed by law. According to the resolution, UW Health paused prescribing puberty blockers and hormone therapy for minors on January 14th, citing a federal directive and concerns about potential enforcement actions that could affect Medicaid and Medicare reimbursement. In addition to calls for providers to resume care, the resolution asks UW-Madison to conduct a review of the decision. It also encourages collaboration from various parties to advocate for legislation protecting health care access for transgender and gender-diverse individuals. UW Health's policy remains unchanged as of right now.